Hey guys, so in today's video, I wanted to take the time to respond to one of your comments. And so what I'm going to do is I'm going to read the comment and then share my thoughts. So this comment was actually shared a while ago and I just kind of lost track of it, so I apologize. But this person said, question, when you're drawing blood and the patient feels like they're about to pass out, is that because of something that we did? So I just want to say that I have been trained, I did my phlebotomy training separately from my medical assistant training. So I know that a lot of medical assistant programs include phlebotomy, but mine was actually a separate 9-week course. My medical assistant training program was mostly online, and so we didn't get a whole lot of phlebotomy, like hands-on phlebotomy training. There were like a couple of days towards the end of my medical assistant training program where we had quote unquote clinical days, but it was not a requirement that you went. It was just for people who wanted to work on those clinical skills. So you have to realize that when you're drawing blood, some people are actually really afraid of needles. They kind of hype themselves up or freak themselves out about the actual procedure of drawing blood. And so there could be a number of factors that go into play with a reason why somebody might feel like they're gonna pass out when you're drawing blood. For one, you are removing blood from someone's system, and that can make people feel lightheaded. It can make people feel nauseous. It can make people feel like they're gonna throw up or pass out, like I said. But there are also other situations where somebody might be so afraid of having their blood drawn, or they have an issue with when they look at their own blood. If the person was to look down as you're drawing their blood and they see that blood there, they might freak out just enough to feel like they're gonna pass out. And that is one of the reasons why like blood draw chairs usually have like arms that go in front of the person's waist, so that if they were to fall forward, they're not gonna fall out of the chair. Hopefully that doesn't happen, but there are a number of reasons, like I said. So it may not just be that somebody is afraid of seeing their own blood or afraid of having their blood drawn. The person could be dehydrated and then you're taking blood from their body, and so it's just kind of like their body is kind of giving out on them. There's a number of different reasons, like I said. So that is why like a lot of labs or clinics where people get their labs drawn have things available to the person, like different types of juice or snacks like a cookie or crackers, something like that, to kind of get the person feeling a little bit better and so that they don't actually pass out. I have never had someone pass out on me, thank God, but I have had someone tell me, like after I drew their blood, I think we were doing like a bunch of specialized testing on top of their normal annual labs. So I had like 6 or 7 tubes that I had to draw that day for this person. And she did tell me that she has felt like she's gonna pass out before. And so I made sure that both arms were down. Like the clinic that I was working at that time, we had a larger lab chair. And so we had 2 arms that come down in front of the person's abdomen. Sometimes if the person is smaller, I will make sure that, you know, we have at least 1 in front of them. But if somebody tells me that they have a history of passing out when they get their blood drawn, I'm putting both of them down just as a protection barrier so that if they fall forward, they're not gonna fall out of that chair. It does make me a little bit nervous when somebody tells me they have a history of passing out when their blood is drawn, just because like I said, I've never had that happen to me before, and I don't want them to be passing out while I have a needle in their arm, obviously, because that could cause injury to the patient, myself, or anybody else who might have to come running into the room to help. Not that when I was working at the outlying clinic, there was really much staff there, because at the outlying clinic, there was a secretary, a nurse, or a medical assistant, and the provider, which is either a nurse practitioner or a physician assistant. So there's only 3 people usually on staff at any given time out there. So there isn't really a whole lot that you can do, but we have like these little water bottles, they're like 8 ounces. And I would order like peanut butter, crackers. We didn't really get cookies. We weren't allowed to order those for whatever reason. So I would get like club crackers, saltine crackers, graham crackers, little like individual serving cups of peanut butter. I would get apple juice, grape juice, and like I said, the little 8-ounce water bottles, so that if somebody started acting funny like that, I could just yell out like, hey, can you grab some juice or some crackers, things like that. It only happened once, that's like that one person that I was telling you about. It only happened once that I needed to get her some crackers and she was fine. I asked her if she wanted something to drink and she said no. So the crackers were fine and they did their job, but just make sure that you're asking people, hey, you know, like if you're not familiar with the patient, asking them if they have a history of passing out or if they have any issues with having their blood drawn. That is something that you need to be aware of as the person who is drawing the patient's blood. Because like I said, you definitely need to have things in place just in case that was to happen. And there could be a person who does not have a history of passing out when they get their blood drawn, and you are the lucky one who they decide to pass out on. So definitely make sure that they're in an area where you have a barrier in case they lean forward when they pass out. It's just something that you have to be cautious of. I didn't always get like juice and crackers or things ready beforehand, but if you can have them close to you, that would be ideal, because like I said, you never know when things like this are going to happen. And so the easier access you have to these types of helps is definitely something that you can look forward to, or you should have available to you. Sorry, that made no sense. But anyways, hopefully this was helpful. And if you guys have any other questions, please be sure to let me know. If there are any other topics you would like me to discuss on my channel in the future, let me know that as well. And I will talk to you guys next time.